Thank everyone for coming. Wow, what a cold day we have today. So nice to see such a great turnout. Thank you for the opportunity to speak. This is a subject that is very close and dear to my heart. As you heard Doctor say, that I am a graduate of a foreign medical school. I did go to Poznań, and the choice is hard. Choice of a medical school is very difficult. And like Dr. Brucker said, the goal is residency in this country. So, I can go ahead and rattle off statistics, but the statistics are important. And the choice of a medical school is important too, because basically this is something that we are preparing for. Sometimes as early as, I'm supposed to be doing that, as early as, a couple years old. So the dream of becoming a doctor or a physician usually is pretty well formed in our younger age. It is a hard hard route for many of us, and the choice of a medical school once again is very important. So I wanted to show you, there's 172 medical schools in this country. I don't show Alaska on here, but Alaska is actually a combination of 5 different medical schools that work together. So most of the schools, as you see, are located in the east part. And I'm going to use my notes here a little bit. But on average, US-bound prospective medical student applies to up to 20 medical schools. So that is something to think about. And each medical school can take up to, at Loyola, from what I hear from the doctor here, the Kalinowska takes up to 15,000 applications for 175 spots. But most schools will get about 3,000 or so. Out of those 3,000 or 15,000, about 500 to 750 are chosen for potential interviews. And in the end, anywhere between 150 to 175 students will be accepted to their classes. So the competition is stiff. Preparation should start very early. And then, of course, medical school is not easy. Only about 82 to 85% of students who enroll in their first year actually graduate. But once you are accepted in a medical school, there is a lot of help. There is a lot of help along the way. And the school officials, especially here in the United States, but also in other medical schools, it is their goal for you to finish. They want you to finish. So there are many different factors that should influence your choice of a medical school, and location is definitely one of them. But also think about what schools you want to go to. This is a census from U.S. News, top schools for research. If you're really interested in research and planning to go, of course, everybody heard about Harvard, Columbia, Johns Hopkins, and the like. Top schools for primary care, which schools are turning out doctors who are interested in family medicine and pediatrics. So these are some of the schools that are, made it top 5. And the lists are very long. Top schools for surgery, if you're interested in surgery, of course, these are the schools to consider. But factors that should be influencing the actual choice of a medical school, for many of us, is a location. Location is important. Family support, I cannot stress that enough. It is crucial. Many of us choose the medical school we go to because we want to live close to our family, maybe to our in-laws. Maybe we have, some financial gain from staying in the town that our family is at. Somebody to cook you a nice warm meal. That is something to think about as well. And also, being away from the family, you do have to invest quite a bit of money into the living situation as well. Specialty, that's something to think about. Look at the school, how many doctors are practicing in that specialty that you really want to go into. Are you going to have a mentor who's going to take you on? Are they publishing? Are they, is the specific department, do they have scandals? How many department heads have that department of, let's say, surgery has had 5 chairmen. Why? Why is that? What's going on in that school? And something that is not really spoken about a lot is your classmates. They know you inside out. They know you inside out because you spend a lot of time together. And these are the people that will vouch for you. These are the people that will say, hey, you know what? Dr. So-and-so, they're so good, I'll have my grandma treated by them. And these classmates will become medical directors. They will become department heads that will help you with changes in your career trajectory. They might even help with movement from department to department. Some of us might, get into residency and find ourselves, hey, this is not really what I want to do. And you have to rely on sometimes, these connections that you have made through your alumni network to help, because it's hard. It's hard to move from specialty to specialty. Also, we talked a little bit about departments. Think about departments that if the school has faculty that is, has a place as a professor, or are they, an independent practice that is working? The independent practice has no obligations to you as a student, 0 obligation. But whereas, the actual people who are employed by the university, that they have a vested interest. So I cannot stress enough how important it is, your choice. With, foreign medical schools, there's not really a lot of reliable objective data. There's a lot of schools are self-reporting. So, it's something that we really need to look into. Lots of the larger and bigger schools are also in the Caribbean. They do self-reporting of the MEDJ data too. So if you really want to get the statistics, you should go to the reliable websites like NMRP. But the truth is, there are 25% of all the physicians that are currently practicing in this country are from foreign schools. So this is a pretty large number. Out of those 25%, Indian graduates, 23%, 18%, Caribbean schools, Pakistan, Philippines, Mexico. So the competition is pretty stiff out there. So really consider where you're going. Perform due diligence. Look at the facility, the learning environment. What are these schools offering? Do they have university hospitals attached to them? Or are they just, I don't want to use that term, a diploma mill, basically? Are they, churning out students left and right, and you don't have any statistics? What are the clinical rotations? Will you have to pay extra to go to an American university? Will that be reflected in your tuition? Because then you'll still be liable to pay for school, and then you'll have additional cost of living in in this country and doing your rotations here as well. Pass rates for USMLE. Is there research experience? Do you have a possibility to publish? Who will you be working with? These are very important questions to ask. And of course, reach out to the alumni. Say, okay, I'm interested in this school. Well, okay, can I talk to any graduates? Where are they? Where are they? Are they available? Will they be willing to speak to you? Do they have an alumni network? So this is something that is very important to consider. So once again, medical school is a wonderful, wonderful experience. It is something that is a true honor to become a physician, to be standing here in front of you. And I just thank you so much for your attention.
Thank you so much.